Greetings. To prevent and also improve various types of hemorrhoids or piles, as well as anal fissures, there are 4 very important points that I will present to you here. The first is not delaying bowel movements. The second is your daily dietary composition. The third is plenty of fluids, and the fourth is sufficient physical activity, even if it's just in the form of walking. Well, it's been 33 seconds, and this was a summary of what I want to explain. For those who don't have the patience, this much might be enough for them, and for those who want to know how and in what way, and want to be better informed, they can pay attention to the rest of the video. Thanks. So, what did we mean by not delaying bowel movements in the first point? I might even say this is more important than the others because it gets less attention, is talked about less, or at least I haven't seen anyone mention this topic anywhere. I, think that, this is one of the few places where, if I don't say the main, it's the first time, and I'll guess that maybe there's been a place I haven't seen, it's one of the few places that is addressing this issue. See, our body has a biological clock. Especially, regarding sleep and about many other things. I mean, when you, have a bowel movement on, a certain day, the next day, at almost the same time, the same hour, give or take half an hour, never mind that. Again, on the following days, at almost the same hour or the same time, you'll get the urge to have a bowel movement. For some people, this biological clock thing is very strong. Regarding wake-up times, the time, you go to sleep, or the state where, so to speak, you start feeling sleepy. In some people, it's weaker. It's not a very strong thing, but it exists nonetheless. So, we can adjust things so that when a person wants to, have a bowel movement, for example on a day off, at the time they'd normally be at work and know that using the washroom isn't very convenient for them, they don't do it then. Especially those who live abroad and prefer their own home washroom to public ones. Some people do. Anyway, so it's important that we pick a time when we don't feel any psychological urgency. Right. Another point I'm making is that, foreign employers aren't like, someone can just go into the washroom and sit there for as long as they want. It's a bit tougher because everything here, the pace of work and everything else, is faster. So, all in all, try to set it up so that you do your business in a calm environment, preferably at home, whether it's once a day or twice a day. Now, this was a general piece of advice, but it's important. We don't pay attention to it because the act of elimination is an automatic process, and the nervous system handles this with great delicacy and, well, with a lot of sensitivity. This is really important, because the precise coordination of both the internal and external anal sphincters, as well as the complex movement or rhythmic contraction of the rectal wall, all play a critical and essential role in the overall act of elimination. It is a sophisticated process that requires these components to work together in perfect harmony to ensure proper function. Now, the important point here is that when a person feels the urge to have a bowel movement, they shouldn't delay it. Now, why is that? Because when you delay it, the amount of stool in the rectum gets dehydrated quite quickly. What does it mean to get dehydrated? It means, what does the wall of the intestine, or actually the large intestine, do? It absorbs water from the stool. See, it absorbs water from the stool under normal conditions too, but because the stool is in transit, it's moving, just like how it goes from the stomach into the duodenum, or the small intestine, and keeps moving along. Because it's moving, the amount that's along the path, gradually as it goes further down, more water gets absorbed from it until it reaches that point. If it stops there, too much water gets absorbed from it, and this causes, actually fecal impaction or, what do we call it? Fecal impaction to occur. It becomes impacted, the stool becomes dense and hard. Once it gets hard, sometimes it even becomes bone dry, and when it dries out, it can cause, hemorrhoids or piles, or an anal fissure for the person. So, therefore, we need to keep in mind that when a person feels the urge to have a bowel movement, they should try to go as soon as possible. Now, it's not that they absolutely have to rush there that very second like it's an emergency. No. They can go in 10 minutes, they can go in 20 minutes, they can go in half an hour, but they should go. And if they put it off, next time they'll find they have very hard stool that's really difficult to pass. That's the first point. The second point is daily dietary composition. Well, pretty much everyone knows this already. If someone knows they're prone to hemorrhoids or, on the flip side, anal fissures, or has had them before, and they know that usually, well, as the old folks say, their bowels are hard, meaning their stool is firm, this person should try to consume things that soften the stool. Foods like fruits, for instance, pears or mandarins, and things like olive oil, plums, prunes, or prune water, where you soak the plums in water and then eat them after they've soaked. Figs, these are things that many people know about, but many might not. These, actually cause they're natural stool softeners, And they should drink plenty of fluids. If they don't drink enough fluids, the person will run into that same problem again. So, also vegetables, fruits, fresh herbs, anything that has fiber, right? Foods and stews that have vegetables in them. In short, someone who knows their bowel's nature is, as the old folks say, lazy. They should try to eat more of these kinds of things. Conversely, things that constipate you, as the old folks say, like apples or bananas, they should consume less of these. And so, the daily dietary combination should be that we use whatever we feel, in fact, helps the bowels move more easily, so that there's no pressure on that final part of the rectum and anus, and the person doesn't end up with hemorrhoids or, on the other hand, an anal fissure. That's the second point. The third point is plenty of fluids, which I've just included so we don't forget, otherwise it goes without saying. When the body faces a lack of water, it absorbs water from the stool more quickly and intensely. Remember, the lining of the intestine has blood vessels that act like a sponge, drawing water out of the stool. When the stool becomes hard, those who have this issue and are prone to it will, in fact, run into problems. I mean problems like hemorrhoids, piles, or anal fissures. And let me tell you, it's interesting that it's said the cause isn't known or why some people are more prone to this issue. So, we won't get into that topic right now. And the fourth factor is getting enough physical activity. Many of you might not know this. See, when the body moves, the intestines also start to have a bit of peristalsis. So, a sedentary body means that peristalsis, or the wave-like movements of the intestines, doesn't happen as well as it should. You know how for people who have surgery, I mean specifically abdominal surgeries, one of the surgeon's concerns is that the patient might develop fecal impaction, or hardening of the stool. That's because, this person has just had surgery, and there are incisions, stitches, and all that in several layers of skin, subcutaneous tissue, and muscle at the surgical site. And then, if this person tries to strain, right? Well, they shouldn't be straining. If they don't strain, the stool won't come out. If it doesn't come out, it leads to fecal impaction, which is a real headache, right? So, anyway, we end up having to give them an enema. Even when someone is constipated, they can perform a light enema at home to avoid straining. But they shouldn't do it too often, because if they do it too much, the bowel becomes lazy and gets used to it, and that's not right. For that same reason, regarding dependency, I should also mention that one shouldn't overuse laxatives, or what we call stool softeners, or anything similar, especially those with lazy bowels. The whole reason I'm recording this video is so that people use natural methods instead. If they just follow these 4 tips I mentioned, even those with lazy bowels won't have any issues. So, I was saying that after someone has surgery, the surgeon tells them that even though they don't want the person to rush into putting pressure on themselves to walk, they say as soon as you're able, you should try to get up and walk around a bit by, say, the second day. Right. I mean, they tell the person to try and walk starting from the second day. You need to walk around the bed and move a bit so that your bowels start working. I mean, for the body to, actually stimulate bowel movement, for the rectum to be stimulated so that the bowels start working and you have a bowel movement, and for the urge to have a bowel movement to kick in, you need to have enough mobility. So, sitting for very long hours isn't good for those who have a history of constipation. So, just follow these few tips, and your problem will be solved. And I'm really happy because after a long time of promising this to many people, from now on if anyone asks me, I'll refer them to this video, because these are the important explanations I wanted to give regarding this matter. Now, for treatments and things like that, if I get the chance and it's necessary, I will record another video. Good luck.